What do people not know about dementia that they should know?
Dementia can be very difficult for families for a couple reasons. Everybody who develops dementia is a little bit different. They started off different with different experiences, different genetics, and the disease can just be a little different in each person, even if their, genetic makeup, even if it's an identical twin who had the same, life experiences, the disease can affect people in different ways. And because of that, there's no simple cookbook recipe of how to help someone who has dementia. And it's always a little bit challenging for families and other caregivers to sort of navigate it and figure it out. I wrote a book with one of my colleagues on this topic called 6 Steps to Managing Alzheimer's Disease and Dementia, a Guide for Families, because it is so hard to navigate. That's another book that's available in your local library. And in it, we talk about, all the different, problems that can come up, because sometimes people have the biggest problem with memory loss, and that can lead, for example, to shadowing. So the person who has fairly severe memory loss may not know where their loved one is, their family member is, if they're out of sight. And the only way that they feel comfortable is to follow them around from room to room. And, if they are away for 5 minutes, even if it's just in the bathroom, the person with dementia doesn't know where they are, and they may feel afraid. They don't know where they are. They don't know what's going on. So that's just one problem that can come up. Sometimes people develop hallucinations, and this can be very frightening for families. Other patients cannot recognize their loved one. They don't know who they are. They may say, I don't know you. What are you doing in my house? Please get out of my house. Sometimes people are aggressive. It's not the most common thing to happen, but especially if you're trying to get someone who has dementia, say, to take a bath or to go to a doctor's appointment and they don't want to do it, it can sometimes cause a struggle. So, there's so many ways that dementia can manifest throughout the course of the disease, which can generally lasts between 4 and 12 years, sometimes shorter, but sometimes longer, that it can be very difficult for families to navigate it. And the other thing that's challenging is just when you figured out what to do at this stage of dementia, bam, the next stage, it changes and the next stage started. So families really do need a lot of help, and that's why we wrote that book, and that's why luckily there is a lot of help. So inside the VA, there are a lot of support groups and help for caregivers. They are a little bit different from one VA to the next. In VISN 1, one of my colleagues and co-authors, Dr. Maureen O'Connor, is a neuropsychologist who runs several of these groups for caregivers. She also does researchers to try and better understand, how caregivers are struggling with their loved ones with dementia and what can be done to help. So in VISN 1, we're lucky to have that resource. She's at the Bedford VA. And other VAs across the country, will have sort of analogous programs to help. I always also recommend that all of my patients at the VA get all of the resources available to them outside of the VA as well. And the Alzheimer's Association is usually a great resource as well. They have a 24/7 hotline that people can call, to ask questions or get help with any problems, any hour of the day, any day of the year.
Hey folks, connecting with your benefits is our primary mission, and the SITREP is providing more options than ever.
Subscribe to our free email newsletter, subscribe to our audio podcast channel, or subscribe to our content on YouTube.
For details and links, check out the description below.